Are you over 70 or close to it? Then avoid these 5 health checkups at all costs. They are potentially dangerous and may even shorten your lifespan. Modern medicine has become so aggressive that doctors often do more harm than good. The following tests are a perfect example of this. Stay tuned and find out which common senior health screenings could be doing you more harm than good. You definitely want to share this video with your friends and family so they can avoid these mistakes too. Let's dive in. Number 1, digital mammograms. For women over 70, mammograms have never been a reliable screening tool for breast cancer. The American Cancer Society recommends women aged 45 to 54 to start annual mammograms, but only every other year from the age of 55 and up. However, the United States Preventive Services Task Force suggests that women over the age of 75 should not get mammograms. Here is why. Digital mammograms expose the breast to ionizing radiation. Every time a woman undergoes a mammogram, her chances of developing breast cancer increase by 1.2%. The Food and Drug Administration recognizes that digital mammography exposes patients to higher levels of radiation than traditional film screen mammography. This risk is unacceptable for women over 70 who most likely have no intention of having children. There is another problem with mammograms. They frequently produce false positives, which leads to unnecessary biopsies. In 2019, the U.S. Preventive Services Task Force concluded that the harms of mammograms outweigh their benefits for women over 75. Number 2, colonoscopy. According to the American Cancer Society, a colonoscopy is a procedure used to look for and sometimes remove growths, such as polyps, in the colon and rectum. Polyps can turn into colorectal cancer if left untreated. So removing them during a colonoscopy can lower your risk of developing the disease. Colorectal cancer is one of the leading causes of death in people over the age of 70. Regular screening is crucial to catch any abnormalities early. So when is it not a good idea? A screening colonoscopy can help find and remove polyps before they turn into cancer. But once a person is diagnosed with cancer, a colonoscopy will not cure the disease. The risks associated with colonoscopies include bleeding, perforation of the colon, and infection. Some studies suggest that colonoscopies may also increase the risk of developing colorectal cancer. This is known as the colonoscopy paradox. It has been observed that individuals who undergo regular colonoscopies have an increased risk of developing colorectal cancer compared to those who have never had a colonoscopy. One study published in the Annals of Oncology found that the risk of developing colorectal cancer was 12% higher in people who underwent regular colonoscopies than in those who did not. The reason for this paradoxical increase in risk is not fully understood. But researchers believe that colonoscopies may cause tiny tears in the colon lining, which could lead to inflammation and promote the growth of cancer cells. People over 70 years old have weaker colons due to age-related changes, making them more vulnerable to the potential risks of colonoscopies. In light of these concerns, some experts recommend avoiding screening colonoscopies for people over the age of 75. Instead, they recommend using non-invasive methods such as fecal occult blood tests, which can detect the presence of blood in the stool, an early sign of colorectal cancer. Other options include stool DNA tests, which can detect genetic markers for colorectal cancer in the stool. These tests are less invasive and carry no risk of bleeding, perforation, or cancer promotion. 3. Prostate-specific antigen test. The PSA test measures the level of prostate-specific antigen in the blood. Prostate cancer is the second most common cancer in men worldwide, so it's understandable that men over 70 want to get tested for this potentially fatal disease. However, experts have discovered that the PSA test has many limitations. It's a highly inaccurate test. Many men with high PSA levels do not have prostate cancer, and many men with low PSA levels do. Therefore, doctors often order additional tests to confirm a diagnosis after a PSA test yields an abnormal result. These follow-up tests can be painful and expensive, Furthermore, overdiagnosis of prostate cancer is a significant issue. This occurs when a man is diagnosed with prostate cancer that would not have caused any symptoms or health problems during his lifetime. Many men diagnosed with overdiagnosed prostate cancer receive unnecessary and potentially harmful treatment. Treatments such as surgery and radiation therapy can cause urinary incontinence, erectile dysfunction, and other issues. These treatments can also weaken the body's immune system, making it harder to fight off infections. If you are over 70 and considering getting a PSA test, make sure to weigh the risks and benefits carefully. Talk to your doctor about your individual situation and whether the test is really necessary. Remember, there is no one-size-fits-all answer. What works for one person may not work for another. Number 4. Bone density test. As people age, their bones become weaker and more prone to fractures. This is especially true for women who have gone through menopause. Bone density tests are used to measure how strong your bones are and whether you are at risk for osteoporosis, a condition that makes bones weak and brittle. Doctors use bone density tests to diagnose osteoporosis and to monitor the disease over time. Bone density tests are also used to monitor the effectiveness of treatment for osteoporosis. But here's the big. Bone density tests expose the patient to ionizing radiation, which can damage cells and DNA. When cells try to repair damaged DNA, they sometimes make mistakes that can lead to cancer. Radiation also increases the risk of developing secondary cancers. Secondary cancers are cancers that develop as a result of treatment for a primary cancer. For example, radiation therapy for breast cancer can increase the risk of developing thyroid cancer. The risk of developing a secondary cancer varies depending on the type of cancer being treated, the dose of radiation used, and the length of treatment. Ionizing radiation is used in many medical procedures, including X-rays, computed tomography scans, fluoroscopy, nuclear medicine procedures, and radiation therapy. Exposure to this type of radiation can damage DNA and increase the risk of cancer. Even small doses of radiation can increase the risk of cancer slightly. Over time, the effects of radiation can add up and increase the risk of developing cancer significantly. If you are concerned about the risks of radiation exposure, talk to your doctor. There are ways to reduce the amount of radiation you are exposed to during medical procedures. You can also ask for alternative imaging techniques that use less radiation. Number 5. Cardiac stress test. A cardiac stress test is a non-invasive test that is used to evaluate the heart's function during physical stress. During the test, you will walk on a treadmill while your heart rate, blood pressure, and other vital signs are monitored. The test is used to detect coronary artery disease, which is a condition in which the arteries that supply blood to the heart are narrowed or blocked. This can cause chest pain, shortness of breath, and other symptoms. But experts say that cardiac stress tests are unreliable because they generate a lot of false positives. This means that people who have normal hearts may be told that they have a problem. This can cause unnecessary anxiety and additional testing. In some cases, people may even undergo unnecessary surgery or other treatments. On the other hand, a cardiac stress test may miss a problem that is actually present. This is known as a false negative result. If this happens, the underlying problem may go undetected and worsen over time. Also, a cardiac stress test is not very useful in diagnosing the severity of coronary artery disease. In fact, it cannot determine the severity of blockages in the coronary arteries. This information is important because the severity of the blockages determines the best course of treatment. Another problem with cardiac stress tests is that they are often too difficult for some patients to complete. This is especially true for older adults and people with certain health conditions. Patients may need to take medication to manage their symptoms during and after the test. This can cause side effects such as dizziness, nausea, and headache. If you have been advised to undergo a cardiac stress test, make sure to discuss the risks and benefits with your doctor. Ask about the accuracy of the test and what will happen if the results are abnormal. You should also inquire about alternative tests that may be less stressful and more accurate. In conclusion, many